By the end of this module, you will describe key physiological and psychological changes associated with aging, differentiate between normal and abnormal aging signs, assess the impact of sensory and cognitive changes on quality of life, apply age-sensitive, person-centered interventions in clinical settings, enhance communication and support for mental well-being in older adults. Aging is accompanied by a range of changes in the body and mind. Some are natural and expected, while others may be pathological or environmentally influenced. This module provides you with an in-depth exploration of the physiological and psychological transformations that occur as individuals transition into older age. Understanding these changes is critical to delivering compassionate, safe, effective, and individualized care. You will learn to distinguish between normal age-related alterations and disease conditions, assess physical and cognitive capabilities, and apply appropriate interventions that promote well-being and independence. This module aligns with gerontological best practices, ICN's Aging and Health Guidelines, and NHS Core Skills Training Framework for older people, and supports accreditation compliance with CPD and global care standards. Introduction to biological aging, cellular and molecular changes, reduced mitosis, DNA repair deficits, oxidative stress, mitochondrial decline and energy metabolism, telomere shortening and programmed cell death, apoptosis, inflammation and immunosenescence, inflammaging, cardiovascular and respiratory system changes, decreased elasticity of blood vessels, increased systolic BP, reduced cardiac output, especially during exertion, calcification of heart valves, decreased alveolar surface area and oxygen diffusion, weakened respiratory muscles and reduced cough reflex. Implications: increased risk of hypertension, heart failure, respiratory infections, reduced exercise tolerance. Musculoskeletal and integumentary system, bone demineralization, osteopenia and osteoporosis, sarcopenia, loss of muscle mass, degenerative joint changes, osteoarthritis, slower wound healing, thinning skin, loss of collagen and elastin, pressure sore risk due to reduced mobility and skin fragility. Implications: high risk of falls, fractures, immobility, and pain management needs. Neurological and cognitive aging, slower neuronal transmission and synaptic plasticity, brain volume reduction, especially in the hippocampus, delayed reaction times and memory retrieval, changes in sleep architecture, less REM, more waking, differentiating normal versus pathological, normal aging, mild forgetfulness, slowed processing, abnormal aging, dementia, Alzheimer's, Parkinson's, sensory and communication changes, visual changes, presbyopia, cataracts, macular degeneration, hearing loss, presbycusis, difficulty with high-pitched sounds, decreased taste and smell sensitivity, tactile sensitivity reduction, delayed pain recognition. Implications: risk of social isolation, communication barriers, nutrition deficits, delayed injury recognition, renal, digestive, and endocrine alterations, decline in renal filtration rate, GFR, drug toxicity risk, slower GI motility, constipation, and malabsorption, pancreatic function declines, insulin resistance, changes in thyroid hormones and adrenal response. Implications: medication management challenges, risk of dehydration, hypoglycemia, and digestive complications. Mental health and emotional changes. Emotional regulation generally improves with age, but risk of depression and anxiety increases with isolation, bereavement, or illness. Grief processing after loss of spouse or peers. Psychological impact of reduced independence or chronic illness. Screening tools, geriatric depression scale, MMSE, PHQ-9. Support strategies, counseling, therapy, social inclusion. Sexual and reproductive health in aging. Sexual interest may remain, but physical changes may influence intimacy. Postmenopausal symptoms, erectile dysfunction, reduced libido. Importance of sensitive communication and support. coping mechanisms and resilience in aging, adaptive strategies, spirituality, hobbies, socialization, learned resilience through life experience, maintaining a sense of purpose, autonomy, and identity, person-centered interventions, health promotion, tailored to aging physiology, e.g., nutrition, physiotherapy, use of mobility aids, sensory aids, hearing aids, glasses, exercise regimes adapted for elderly, multidisciplinary collaboration in care plans,